Welcome to the Medical Center Show. Hi, I'm Joe Scott, the President and CEO of Jersey City Medical Center and Liberty Health. Today we have with us Dr. Ken Garay, our Chief Medical Officer. We're going to talk about the future of healthcare in Hudson County. We'll be right back.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want. Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice.
Welcome back to the Med Center Show. Today we have Dr. Ken Garay, our Chief Medical Officer. Welcome, Dr. Garay. We're going to talk a little bit about the future of healthcare in Hudson County. Tell me, what about the plans for expansion at Jersey City Medical Center?
Well, we're looking at 2 types of expansion. One is the clinical expansion of services that we offer to our patients at Jersey City Medical Center in Jersey City as well as Hudson County, as well as the actual geographic expansion of facilities, of real estate within Jersey City.
So let's talk about the medical expansion. So our cardiology program has really expanded over the last couple of years. You know, I think 5 years ago, we weren't really doing that much open heart surgery, but now we've got a new cardiac surgeon, and our program is expanding even more.
We have the only comprehensive cardiology program in Hudson County. When I say comprehensive, we diagnose and treat patients of all types of, with all types of cardiac disease, from the diagnostic to finding out what the problem is, to potential intervention where we talk about opening up the arteries with stents, to potential open heart surgery. As you mentioned, Joe, 5 years ago, we did less than 100 open heart surgeries at the medical center. We recruited 2 of the top cardiac surgeons in the state, and this year we're going to approach 300 open heart procedures at Jersey City Medical Center.
Wow, 300 open hearts. That's a pretty amazing number.
It's an amazing number, and most importantly, all those patients have done very well.
So the outcomes are really, really good.
The outcomes are outstanding.
Yeah.
That's part of what that's what who we are is looking at our outcomes, and it's very important to us to make sure that we are the best in class hospital for acute care.
Right.
And by that I mean that we look at ourselves, and nationwide we look at hospital care, looking at quality of care, safety of care, and our goal at Jersey City Medical Center for the past 5 years has been to be in the top 10% in the nation. And I am very proud to be the Chief Medical Officer of a hospital where we are in the top 10% as far as offering quality care to our patients and safety to our patients, our employees, and the physicians who practice at the medical center.
Now, one of the things we do, I know, is electrophysiology, and we're getting ready to actually expand the physical plant to be able to accommodate more and more electrophysiology cases.
Yes, we have.
Talk a little bit about the electrophysiology process. You know, that's for patients who have some kind of electrical conduction of there's a problem with
They're
electrical
arrhythmias.
conduction? Okay.
Normally the heart beats in a normal, steady rhythm.
Right.
And there are patients, unfortunately, who at certain times develop an irregular heartbeat.
Right.
So this is a way to diagnose and to treat and get their heart beating back into a normal rhythm. And we've all heard the term pacemakers. Sometimes the heart paces too slowly.
Right.
So what we do is we implant pacemakers into the patient so that it'll regulate the heart to beat at the proper rate. So those services have expanded tremendously at the medical center to the extent that we now have to expand our facility to accommodate more physicians and more patients who want to perform those procedures at the medical center.
Now, in order to do that, there's special equipment that we had to buy, and we're looking actually at expanding our cath lab to be able to provide another room, so
Yes,
we can
we are.
provide more and more of those electrophysiology services.
Absolutely. We're looking to, we have two cardiac catheterization rooms now.
Right.
We're looking to open our third one. We have space available in the floor, and now we have to outfit it, which we are in the process of doing, so we can expand our services to the community.
Wow. Now, the other thing that we do really, really well with the recruitment of our new vascular surgeons is some vascular surgery and some vascular intervention. We're putting some new equipment in the radiology department to accommodate our vascular surgery program.
As healthcare has exploded in the past 10 years with new technology, one of the great advances is something called endovascular approaches to blood vessel diseases.
So tell everybody what that means.
And I will. And what it involves is, in the past, in order to treat, let's say, aneurysms, which are outpouchings of the blood vessels, or blocked arteries, surgeons would have to make external incisions in the body to clear out the blockage and to insert a stent. Now, with the technology that we have and the surgeons and the doctors that we now have on the staff at the medical center, we're able to make small, tiny little incisions in the groin, enter the blood vessel, and through imaging and X-ray technology, find where the blockage is and place a stent and bypass that. And we've had some tremendous success with this.
So rather than cut somebody open, now you're just talking about almost like inserting an IV. So
like
it's
a needle
minimally
stick.
invasive. Yeah,
It's
like
a needle stick.
Wow.
And these patients often can go home either that same day or the next day.
Now, I know that there's a big project to improve the equipment down in the radiology department where these vascular surgeons will work. It's like a $3 million project,
This
right?
is a $3 million project to bring in state-of-the-art equipment. And what it also does is, as we're growing and as we're merging into Barnabas Health, we're expanding our clinical activities. We're planning on introducing a comprehensive cancer program.
Right.
And one of the new techniques in treating patients with cancer is through interventional radiology, where we intervene to block off the cancer and to treat the cancer directly on the spot with these new techniques.
So rather than like infusing chemotherapy and affecting your whole body, they can kind of keep it localized to one area?
They can treat it localized, correct.
Wow. Wow, and we'll have that capability
We will
with
have
this
that
new
capability
equipment
to do that.
we're looking at expanding.
Exactly.
Wow. Tell us a little bit more about vascular surgery. We've recruited a couple of new vascular surgeons. I mean, they've done some phenomenal work, right? I mean, we're the trauma center, so we sometimes get patients who might have crushing injuries. These guys have really done a great job.
We are a 24/7, 365-day-a-year hospital. And I like to talk to colleagues of mine that we're sort of a hybrid hospital where we do provide primary care for many patients in Jersey City and Hudson County, but we also are the tertiary hospital where we treat patients with complex diseases, complex illnesses. We are the regional trauma center, so we do see patients with serious injuries to the internal organs as well as to vascular structures. And we're able with these injuries and to really treat them aggressively and quickly to reverse the process and to get them back into normal health.
Wow, that's great. Our emergency department kind of gets a little crowded sometimes. So we're looking at an expansion there also. We're looking at further expanding the capabilities of our ER.
Yes, we are. And we're looking at it in two different ways, actually. One is actually expanding the physical plant.
Right.
We have a process going on now where we're looking on campus to build an additional structure, 200,000 square foot office building that would be
Right.
combined for a comprehensive cancer program, medical offices, as well as to expand the emergency room. Our emergency room was built, we're coming up to the 10th anniversary of the new medical center.
Right.
Was built for about 55,000 patients. We're seeing upwards of 85 to 90,000 patients now.
Wow. Wow, look how far we've come in 10 years. Huh?
amazing.
It's been an amazing, amazing transformation, moving down from the old medical center onto the new campus. And now we continue to expand and really meet the needs of everybody in Hudson County.
It's very exciting, for me it's exciting because every day I receive phone calls from colleagues of mine from out of the area throughout the state who've heard about the quality of care that patients receive at the medical center.
And they wanna
actually,
join us?
they want to be part of the medical
Yeah.
center.
Nothing better than that.
There's
If they
nothing
come, they come and ask us to be part of the medical center.
It's the best.
We'll be right back.
Jersey City Medical Center consistently receives the highest hospital ranking and ratings in New Jersey. #1 overall hospital in the state, #1 for high-risk pregnancy, #1 for neurological disorders, #1 for stroke, Magnet Award for nursing excellence, A for hospital safety. What makes the Jersey City Medical Center the #1 hospital in the state? Top-rated, award-winning medical professionals you can see today at the Jersey City Medical Center. Make the #1 hospital your first choice, the Jersey City Medical Center. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for nursing excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org.
Welcome back to the Medical Centers Show. I'm Joe Scott, the President and CEO of Jersey City Medical Center and Liberty Health. I'm here with Dr. Garay, and we're talking about the future of the medical center. So one of our objectives, obviously, we talked a little bit about the expansion of the emergency department, but we see a lot of orthopedic patients come to our hospital because we're a trauma center. Tell us a little bit about the orthopedic doctors that work at the medical center.
Well, we've been very fortunate to, in the past year and a half, to recruit a number of young, fellowship-trained, specially trained orthopedic surgeons. One of them is one of the only fellowship-trained physicians in orthopedic trauma.
Wow.
These are patients who come in who suffer catastrophic orthopedic bone injuries, requiring joint replacement, requiring all sorts of innovative new technology. So we have that service available now. Interesting point about on Labor Day this past year, our surgeon got a phone call from a patient who was in Iceland,
Wow.
who had a orthopedic trauma in Iceland, who the patient then flew into JFK and straight from JFK came to the medical center for repair of her severe orthopedic trauma, and 4 days later went home.
Wow.
So we do amazing things when it comes to orthopedic trauma. We also have the only complete and comprehensive hand service in the county. And
So if somebody gets a crushing hand injury or something happens to their hand,
They-
we've got the specialists there to treat them.
we've got a complete
And other
team.
hospitals don't have that.
No, they don't.
Yeah.
No, they don't. And certainly in Hudson County and in North Jersey, we're one of the few, if not only, hand services that are available for patients with hand injuries.
Wow.
And they're trained, specially trained, both in orthopedics and in plastic surgery, specifically to deal with vascular and or crush injuries of the hand.
So, as we look at the future of healthcare, one of the things that all healthcare facilities are going to be challenged with is providing care to the patients in the most appropriate venue. So one of our goals is to provide convenient, accessible ambulatory services. Talk a little bit about some of the expansion plans that we have. I mean, we've got the medical office building on the campus, but we're actually reaching out into the community with some other locations.
Yes, we are, and we've sat down and looked at it, and one of the things we all feel that going forward is to be, there was an old saying in medicine when I was training, the 3 A's. You had to be.
That was a long time ago. Right?
That was a long time ago. Not that long ago, but a long time ago. But it was the 3 A's of availability, of affability, and ability. And the availability is very important.
Sure.
And so our focus is in the coming years to go out to the community, to reach out to the community into various sections, to be there for them. And we've looked at the Greenville section, the old Greenville Hospital,
Right.
Which was closed several years ago, and we're in the process of reopening it and putting an urgent care center there, as well as outpatient physician offices
Right.
to treat the community in the Greenville section of Jersey
Right.
City. We're
Well,
looking.
that'll be a great. When do we think that will happen?
That should happen hopefully by the end of 2014.
Right. So that's good. So we'll have actually a healthcare facility right back in Greenville.
It's almost
again.
like reopening another hospital.
Right. Wow, that's great. And there'll be an urgent care center there, so people who have kind
Any-
of minor injuries, they can go there without having to come all the way to the medical center.
Exactly. It's convenient. It's in the neighborhood. It's
Right.
it's very it's almost like one-stop shopping.
Right. So that's a convenient, accessible
Available
ambulatory service.
ambulatory service. Exactly.
Now, we're planning something also at the Grove Street Path.
Yes, we are. We're planning several different programs there. One is a women's center.
Right.
And we feel that it's important, and the time has come to have a comprehensive women's center dealing with women's issues of both cardiac nature, female issues. We're going to be staffed by physicians who treat urologic problems, medical problems, cardiac problems, complete comprehensive programs. We're looking to put in another digital mammography machine
Wow.
down in the
Yeah, because our mammography is like filled all the time, right?
We've got our Christie Kerr Center on the campus is filled 7 days a week. We're now doing mammography 7 days a
Wow.
week. We were the first digital mammography center in Hudson County several years ago. So we're looking to add a second one in the medical center itself.
Wow.
We're in the process of putting one in right now.
Okay.
But we also want to go out to the community, so make it easy and available and accessible to the members of the community.
Wow. So the Grove Street Path is one area. Now, we've got a couple of things, we call them health stops, right? And we've got one in Paulus Hook and one in Hoboken.
Correct.
Okay.
And we're looking to put several more health stops, which are urgent care centers that, again, patients have minor complaints or issues. They can stop in after hours or during daytime, but particularly after hours, to go in and see a physician or nurse practitioner to diagnose what their problem is and get an immediate, quick treatment.
Wow, that's great. So that whole convenient, accessible ambulatory services for Hudson County is really a key strategy moving forward, and will help keep people out of the hospital, try to keep them healthy,
you
right?
You know what? The whole idea is to keep a hospital for patients who need to be in a hospital,
Right.
and not to overcrowd the emergency room or the hospital with patients that can be treated in their local setting.
Right.
And what we've also done, we've introduced this year an online ability to schedule appointments
Right.
for the emergency room or for the health stops, as well as for x-rays.
Right. So somebody can go online, rather than come to the emergency department, see kind of what's open, and then go and get treated at any one of these other convenient locations.
Exactly, knowing that there's the safety net of the hospital behind them. And so that if they go into one of the health
Something
stop
more
areas,
serious, they can get treated at the hospital
they can
quickly.
get, there's a dial from the health stop right to the hospital, to the emergency room, that
Right.
the patient needs more significant coverage and treatment,
Yeah.
and that's on the way.
One of the things that we're also looking at in the medical office building is we're going to put a PET CT scanner there in the next couple of months, and expand further our radiology services that
Correct.
are in the ambulatory, in the medical office building.
As we're growing our oncology services, the importance of PET CT scan in staging and treating and evaluating patients with cancer has grown. So we are putting one in the medical office building,
Right.
Along with our strategy for 2014 to develop a comprehensive cancer program. We've already started that, actually, in that we've recruited among our physicians some of the top surgical cancer oncologists.
Wow.
In the state.
Okay. And so they're going to be doing work also at the medical center.
They have already been doing work at the
So
medical
this is
center.
really a comprehensive, I mean, we're not just a small community medical center. We're really the tertiary center in the area and provide a comprehensive list of services.
Absolutely. That's what I mentioned before. We're like a hybrid. We do provide primary care for many people in the community,
Right.
but we are that tertiary center that patients in 2013 and certainly in 2014 do not need to leave Jersey City for
Right.
their health care.
Wow, that's great. One other thing, in our medical office building, we also have an ambulatory surgery center. So they don't even have to come to the hospital for outpatient surgery,
Absolutely.
right?
Cool.
We work with the physicians and with a surgical company to run an outpatient ambulatory center.
It's a comprehensive surgery center where patients can come in the morning, have their surgery or procedures, whether it's a colonoscopy perhaps
Right.
or surgery, in an outpatient ambulatory setting, and come in and go home the same morning.
Wow, and that's convenient, accessible.
Convenient, easy, quick,
Right.
and safe.
And safe. That's the most important thing.
And safe.
Okay, we'll be right back.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Welcome back to the Medical Center Show. I'm Joe Scott, President and CEO of Liberty Health, Jersey City Medical Center. I'm here with Dr. Garay. We're talking about the future of healthcare in Hudson County and some of the great things that happen at the Medical Center. So Dr. Garay, one of the things that we started working on was looking at some of the community needs. We actually did a community needs assessment. As the only not-for-profit in our area, we're required by the federal government to do a community needs assessment where we look at all the different issues that could potentially impact the healthcare in Hudson County. Now, the other hospitals in our area are for-profit and they're not required to do that, but we are, and we think it's a good thing to do to kind of look through what the needs of the community are and then develop programs around those needs. One of the things that popped out was cervical screening for women, and I was kind of surprised, although when I look back at the history of Hudson County, even the fact that we didn't have digital mammography until we put it in at the medical center 5 years ago, it doesn't surprise me that something like that would pop out. So we talked about convenient, accessible ambulatory services. Is the cervical screening going to be part of the focus for the medical center as we move forward?
Yes, it is. And we're looking at something called population management and disease management.
Right.
And that's part of going forward with the Accountable Care Act and where we're heading as Americans in healthcare. And we have many chronic diseases that we need to manage and treat and control, and including heart failure, asthma, diabetes. And part of it, as you mentioned, in our survey, we found that there's a disproportionate amount of cervical cancer. So our thought is that these patients, these young ladies, are not getting screened, not getting treated early enough. So that's part of our education plan in 2014, to go out to the community, to go out to local pediatricians, local health districts, and really focus on cervical screening and dealing with that problem.
Now, of course, because we are not-for-profit, we partner with the federally qualified health centers in the area to really kind of raise awareness about some of these issues. So they're willing to partner with us on some of these things also.
Yes, they are, and we're working very closely with some of the FQHCs, as we call them.
So Horizon,
Metropolitan,
Columbus, Metropolitan, and North Hudson.
Correct.
So we've actually had some discussion with them about how we can really focus on the needs, especially of women, especially as it relates to the cervical cancer, because it was something very surprising to me that kind of popped up.
Yeah, we were all surprised because we have an interesting city in that there are different populations, and so we are trying to localize particularly where that need is.
You know, as the not-for-profit provider in the county, we also look to partner with other organizations. One of the exciting partnerships that I'm looking forward to is working with the Boys and Girls Club to develop this charter high school around healthcare education. That's really exciting.
Oh, it's very exciting. It's the future, and this is what we need in this country, is to look at the young people and mentor them and train them for the future and what the future needs are. I remember as a high school student, again, Joe, many years ago, there were
I wasn't going to say it.
there were programs that I remember in high school. We would go in the afternoon to a local hospital and walk around and see what it was like to be in a hospital setting. This is taking it not one but light speeds further, where we're actually identifying students who have an interest in healthcare and really mentoring them and training them to step into the opportunities and to really serve the public in healthcare.
Yeah, that program is going to be really cool because the first 2 years, they're building a new building for the Boys and Girls Club on Marin Boulevard. And in there'll be classrooms for the first 2 years. So freshmen and sophomore, they'll actually be in a brand new building right on Marin Boulevard. It's a high-rise building that the Boys and Girls Club is going to move into. Then the second 2 years, they're going to move on to our campus.
Right.
And every child who goes to that high school will not only meet all of their college requirements, but they'll also